Hi, I'm Charlotte Moser, the co-director of the Vaccine Education Center at Children's Hospital of Philadelphia. And today on VEC Vaccine Notes, we're going to be talking about Lyme disease. Now, Lyme disease was determined to be a new illness around 1977, but the first cases occurred in the early 1970s when a group of children in the area of Old Lyme, Connecticut, developed symptoms that were first thought to be juvenile rheumatoid arthritis. But the healthcare providers that were taking care of these children realized that there were some unexpected clusters of these cases, and some of the symptoms weren't quite in alignment with what would be expected with that condition. Particularly, they were concerned about unusual skin lesions. And so they decided to study these cases more closely, and by 1977, it was determined that this was in fact a new disease. It got its name Lyme disease because of the area where these children were first diagnosed. Over the next little bit, we're going to talk about Lyme disease, what causes it, as well as the symptoms and complications that can occur. We'll talk about an older vaccine that's no longer available in the United States, as well as a newer vaccine that's undergoing clinical trials. But at this moment, and we're taping this in January of 2026, there is no Lyme vaccine available in the United States. We're going to also talk about common questions we get at the Vaccine Education Center. And although we'll go over the risks associated with this disease, we're not going to be able to compare those risks to any vaccination, since no one in the United States currently has a choice to protect themselves through vaccination. Lyme disease is caused by bacteria from the species known as Borrelia. Now, several different types of Borrelia bacteria can spread this disease, but the one that's most commonly causing Lyme disease in the United States is known as Borrelia burgdorferi. So how does this happen? The short answer is ticks. So let's take a step back. Borrelia bacteria can infect small mammals like mice, chipmunks, hedgehogs, and squirrels. And it can also infect birds and larger mammals, including people. So if one of these animals is infected and a tick bites that infected animal, then the tick can become infected. Subsequently, when that tick goes and bites a person or another uninfected animal, it can spread the bacteria to that person or animal, causing them too to have an infection. Now, a few things are important when we're thinking about the potential for Lyme disease. First, Lyme disease can only spread in parts of the country where infected ticks are found. In the United States, that most commonly means the Northeast, the Mid-Atlantic, and the Midwest regions. Lyme disease has also been found in some other parts of the world, including in Scandinavia and Central Europe, Russia, China, and Japan. The second point that's important is that simply being bitten by a tick doesn't mean that a person's going to get Lyme disease. Two things have to be in place. First, the tick must be a kind of tick that actually carries Borrelia bacteria. And second, the actual tick that bites the person has to be infected with that bacteria. And it must have been attached to the person's body for at least 36 hours. This is why people are encouraged to check themselves for ticks after they've been outside, particularly in an area where they may have ticks that cling to them. If a person is likely to have been exposed to the bacteria based on these criteria, then they may be prescribed antibiotics. But those antibiotics have to be started within 72 hours of tick removal in order to have the best chance for stopping the infection. While most people who are treated with antibiotics completely recover, there's a small number of people who continue to have lingering symptoms, and we'll talk more about that condition a bit later. Also, some people tend to develop severe symptoms before they even can be treated. While Lyme disease cases have increased over time, they remain underdiagnosed. In recent years, about 100,000 cases have been confirmed each year in the United States, but the estimates are that there are actually closer to about 500,000 people diagnosed and treated annually for Lyme disease. So what happens when people get Lyme disease? This disease typically has two stages. In the first stage, about 70 to 80 of every 100 people will develop the classic bullseye rash that many people associate with Lyme disease. 2 points are important here. Not everybody develops that rash. And second, for some people, that rash can become quite large, spreading over 12 inches or more in diameter. The rash can develop within 3 days of exposure up to 1 month after exposure, making it difficult to tell when someone was originally exposed. The second stage of disease occurs as the bacteria spread through the person's body, and this can occur over days to weeks, and it can lead to symptoms like fatigue or tiredness, headache, fever, neck pain, muscle pain, joint pain, swollen lymph nodes, even development of additional bullseye or target-like lesions. It can also lead to inflammation of the heart or neurologic diseases that result in partial facial paralysis or weakness, meningitis, which is an inflammation of the lining of the brain, or radiculoneuritis, which is inflammation of the nerves that are at the base of the spinal cord. About 60 of every 100 people who are bitten by an infected tick and not treated with antibiotics will develop arthritis in one or more of their large joints, a joint like their knee. That arthritis will tend to develop within weeks to months, and it can take years to resolve. When people are treated with antibiotics, their symptoms usually resolve within 2 to 4 weeks. But as mentioned earlier, some people may experience prolonged symptoms of fatigue, body aches, or difficulty thinking, even after they've been treated. This condition is called post-treatment Lyme disease syndrome, or PTLDS. Now, 2 points about this condition are important to be aware of. First, we don't really understand why some people experience these lingering symptoms of disease. And second, these symptoms that people experience tend to be similar to those that other people experience after certain viral infections, like when they've had COVID-19, Ebola, or dengue. While the symptoms people with PTLDS experience may be helped by treatment, there is currently no treatment for the overarching condition itself. So let's turn our attention to the situation with vaccines against Lyme disease. As I mentioned earlier, there currently is no Lyme vaccine available in the United States. However, we did used to have a Lyme vaccine. Between 1998 and 2002, there was a vaccine known as Lymerix. But unfounded rumors about its safety made people wary of using it, and the recommendations for its use were limited to a fairly small group of people. These 2 factors combined to limit the use of the vaccine so that eventually the manufacturers stopped making it. The history of this vaccine offers an example of how unfounded concerns about vaccine safety can have real-world consequences. Since each year in the United States, about 500,000 people are affected by this disease, and we had a way to protect against it. But the technology has sat on the shelf for more than 20 years. It's sad to think about how many people could have been protected from developing arthritis caused by Lyme disease if that vaccine had still been available. Now, the good news is that there is another vaccine in clinical trials, so hopefully that vaccine will be found to be safe and effective, and we'll again have a vaccine in the near future that can help people protect themselves against Lyme disease. The potential new vaccine that's in clinical trials now is made using a surface protein from the Borrelia bacteria. The protein is known as protein A, or OSPA, O-S-P-A. Scientists took the gene, or what we call the blueprint for OSPA, from the 6 most common Borrelia bacteria that cause Lyme disease. And they put that gene into a type of harmless bacteria so that when the bacteria divides, it produces the protein. That protein is then purified away from the bacteria, and the 6 different OSPA proteins are mixed together in equal amounts to create the vaccine. The clinical trials have evaluated both 4 and 5 shot dosing regimens, and they've measured the immune responses that develop after receipt of all those doses in people between 5 and 65 years of age. The doses are given over a period of 30 months, and the studies to date have suggested that with either dosing regimen, 9 of every 10 recipients develop immunity. However, we do need more clinical trials before this vaccine would be approved for use in the United States, so we need to stay tuned and see what will happen. If you're interested in finding out more, we have additional details on our Lyme webpage at vaccine.chop.edu. So let's turn our attention to some of the questions that we get at the Vaccine Education Center. Some people wonder about the accuracy of Lyme tests that they can get without a prescription. And in short, the answer is that these tests should not be considered as reliable predictors of whether someone has Lyme disease. Unfortunately, this disease suffers from an interest by the wellness industry that leads people to profit by promoting unproven diagnostics and treatments. We have a link to an article about this on our webpage. It was authored by Dr. Andrea Love, a scientist who's done research on this disease. Sometimes people wonder if they're diagnosed with Lyme disease, if that means they're going to get chronic Lyme disease. And the answer here is not necessarily. But first, it's important to realize that the term chronic Lyme disease is used less frequently now because the word chronic may be interpreted to mean that a person has an ongoing Borrelia infection. But that's not really the case. This is why people have started using the term post-treatment Lyme disease syndrome, or PTLDS. Now, back to the question at hand. Does a Lyme diagnosis automatically mean the development of a lingering condition? And the answer here is, again, not necessarily. Most people are going to be successfully treated with antibiotics and fully recover. But unfortunately, there is a small group of people who will experience these lingering symptoms even after they've been treated. If you're someone who feels like you may have lingering symptoms from Lyme disease, we recommend first talking with your own healthcare provider. But you may want a second opinion, or they may even refer you to an infectious diseases or immunologist specialist at an academic medical center. An academic medical center is a hospital that's associated with a university. Because they tend to be larger institutions with people who study very specialized conditions, they often have specialists who've seen more cases of a condition that occurs fairly rarely. As such, they can help you determine whether what you're experiencing might be lingering symptoms of Lyme disease or if something else is happening. Some people ask if they find a tick on themselves, should they start taking antibiotics? And the short answer here is no. As we've discussed, there really needs to be 3 things in place for somebody to develop Lyme disease. It has to be the kind of tick that can be infected with Borrelia bacteria. The actual tick that bit the person has to be infected with Borrelia. And the tick has to have been attached for at least 36 hours. If you're somebody who had a tick attached, but you know it's been less than 36 hours, you can just remove the tick and clean the area where the bite is. If the tick was attached for at least 36 hours or more, or if you aren't sure how long the tick was attached, then it may be useful to seek medical care. The healthcare provider is probably going to ask about the type of tick that was attached, if you still have it, if they can see it, or if you took a picture of it, and where you were when you got the tick attached to you. And all of that information will help them determine the probability of potential for Lyme disease. With that information, then they'll go on to determine whether antibiotics would be recommended or not. Okay, so let's finish up with a consideration of the risks of this disease. As we mentioned, each year about 500,000 people in the United States are estimated to be treated for Lyme disease. People can experience severe symptoms, including neurologic symptoms. And if left untreated, Lyme disease can result in long-lasting joint pain or arthritis. Even with treatment, a small number of people will experience lingering symptoms that are referred to as post-treatment Lyme disease syndrome, or PTLDS. Unfortunately, at this time, vaccination is not an option for people in the United States, but hopefully this will change sometime in the near future. Thanks for listening today.